family physician. We have a presentation of healthy living. We have talked about, we have listened to very nice presentations on obesity, and very nice presentation from our colleague from on diabetic ketoacidosis, which is a very lethal and very devastating condition. If we look at that, how many of us are believe that following a living healthy lifestyle is going to prevent most of our chronic problems? And following a healthy living, is it important for us in order to prevent us from chronic illnesses? How many of us think that this is true? That's true. So before we go on and start with presentation, our colleague also has mentioned obesity, and the mainstay is to prevent the problems. So preventing the problems is actually starting from the sensitization of our living lifestyle. So my presentation will talk about balanced diet, and it's in a very lay term language, and I try to avoid medical terminologies, and we talk in very simple way. So balanced diet, and then dietary advices, regarding diabetes, and some insight about energy drinks. And this is something which is we think that might be relevant to the general population also. So, balanced diet. Balanced diet is, we talk about balanced diet. What is balanced diet? Which contains all the food items. It's not just proteins, as my colleague mentioned. It's not just keto diets, not just carbohydrates. It's the combination of all the ingredients that we eat, and the mainstay is how are we going to consume all this, because fats per se is not bad, and the other things are per se is not bad. The way we use it is something which is thinkable, and the concept is we have two phenomena: the input, the way we eat, the way we drink, how much amount is an input, we process it, and their output, how much we expend. I mean, how much we utilize it. This is the key factor. It's not just one factor. There are two factors: the input, the processing, and then the output, which is our physical needs. So if we talk about our caloric requirements, generally speaking, for the women, it is 2,000 calories per day they require to maintain their normal activities. However, if they wanted to lose weight, so they can decrease up to 1,500, and they may have these 1 pound of weight decrease, but that's something which is very different from persons to persons, and my colleague has rightly mentioned about the amount that we take, and then it's loss of weight. And about the men, we have 2,500 calories per day we usually need to consume to maintain, and if we wanted to lose weight, we can start with 2,000 calories, and then we tailor it on individual basis. So what are the components in the balanced diet? We have fats, proteins, vitamins, and the water. So combination of all these things should be included in our diet plan in order to stay healthy. So let's take general and specific basic functions of each of that in a very layman language, not in a very medical language. Carbohydrates, which may have sugars and fibers. Sugars are for mainly providing energies. Calories are there for it. Fibers, what it takes. Fibers are there to prevent constipation. Fats for growth and repair of the cells, and proteins are for growth and repair. Fats is for energy and insulation. We have then vitamin C, which is for the healthy skins and the gums. Vitamin D and calcium is for our bones. So these are the effects that we should have in our mind while we are consuming foods. And that's the reason we need to have all the components in our body. And water is to actually resolve and dissolve and transport all these systems, substances into our body in order to be more functional, more active, and more productive. Okay, now let's look at this famous food pyramid. In this food pyramid, you observe that in the base of the pyramid, you have a very wide range of food product, which is carbohydrates, and the carbohydrates includes breads, cereals, rice, and pasta. They usually say that it should be around 6 to 11 servings in order to maintain a good dietary requirement. If you go a little up, the fruits and the vegetables. Fruits servings should be 2 to 4. We'll discuss in the next slide how much each serving exactly what do we mean by one serving. Vegetables, 3 to 5 servings. Then we have up above milk, yogurt, cheese, maybe 2 to 3 servings. Then in the side of that, we have meat, poultry products, fish, dry beans, eggs, nuts, 2 to 3 servings. And then on the top, we have fats, oils, and sweets. It just need to be sprinkled or to cherish our taste buds. But unfortunately, we have upside down pattern. We take the upward tip of that into the downwards, and frequently using the fats and the chocolates and all that. And on the middle, we just take fruits and vegetables to sprinkle in our diets. But that's not actually a healthy approach. So let's talk about serving sizes. If you talk about serving sizes, for the bread and the cereals, it differs upon which kind of food item you're having. So 1 cup of cereal, or half cup of pasta or rice, or even 1 slice of bread, it's comprised of 1 serving. So, and in vegetables, the half cup should be 1 serving, and fruits should be medium sized. Dairy products should have 1 cup of milk, proteins 3 ounces, fats and oil just 1 teaspoon. So depends on the amount that you're taking. It signifies the servings. The idea is here, the message that we wanted to get from this slide is we need to have low calories food items in order to have more bulk and very less calories. So if you observe that just 1 slice of bread makes 1 serving, but 1 cup of cereal or 1 cup of pasta or rice can have the same amount of serving, and then we need to divide it into like this. So let's look at this plate. We need to have all the quadrants of food items. It should have, our plate should have proteins in it, 1/4, should have vegetables in it, 1/4, fruits and vegetables, actually the half of our servings of the amount that we eat in lunch or dinner. And we need to have some parts in the grains and also the proteins, and then from top of it we need to have some dairy products. So it is the combination of all the food items from all the categories in our lunch or a dinner in order to stay ourselves healthy, because we need energy, we need things to get our hairs and nails are healthy, and our body to be more active, and we can think, and we need to be more productive, not just to decrease and limit our calories, so that we would not be able to perform our normal daily activities. Okay, now let's talk about some dietary advices specifically for the diabetes. As we have this theme of diabetes, so let's talk about some specific points. And we need to be very careful that diabetic diet programs, or any diet program in general, not just diabetes, you need to prioritize things first, tailor it individually, and then individual assessment of the treatment. And there is no one single thing for everyone. It's not like that. Everyone has its own lifestyle of own eating habits. So first you need to elaborate on the person's baseline eating habits, and then you need to individualize the plan. after the assessment. And obviously, it should be practical. It should have also pleasure, because we also eat for pleasure. And respect the individual choices. So it's very important that you respect individual choices in order to, in order to adapt according to their life and according to their preferences, because it should be realistic, and should be compliance. So, why is it important? If you consider diabetes, why is it important to focus on our diet? It actually helps us to control the blood glucose level. Obviously, complications, as we discussed diabetic foot, we discussed TKA. So the thing which starts is, the more you have good diet, the lesser you have the complications. Body fat, insulin resistance. It is also playing role. Diet plays role in our insulin resistance, and risk of other diet-related diseases. So dietary controlling our diet is not just focusing on diabetes. It's actually focusing on a lot of problems like hypertension, like ischemic heart disease, and a lot of others. So having a good, balanced, healthy diet, you could prevent yourself from a lot of diseases. So it's just one solution for a lot of chronic problems. And we have minerals, proteins, fats, which are essential for our health. So this combination of all is also relevant for all the diabetic patients, not just healthy patients. Diabetic patients should also have all these proportions, but in a very balanced way. So we have people with diabetes shouldn't have bananas, grapes, and melon and mango. Is it true? Should not have, or it should have in a balanced way. Sweet foods and puddings? No. Lots of sugary drinks? Is it true or false? No. People with diabetes should have used diabetic products. Diabetic products? Not really, because the main concept is, you need to do balance. You need to plan a balanced diet, not just the diabetic food products which are fancy. Always snacks in between, and follow a special diabetic diet. It should be tailored, but not something which is very different from general population. So, which nutrient actually affects the blood glucose? What we are concerned about is obviously carbohydrates that we consume, natural sugars, starches, and then added sugars. These are all contributory factors in order to, if you wanted to make a patient or yourself, in order to control good diabetic, in order to control good control of your glucose and diabetes, you need to monitor these products. All affects the blood glucose. Now, let's think of this meal plan. So in the breakfast, this gentleman is having a large bowl of cereals with milk, 2 toasts with butter, 1 glass of fruit juices. Mid-morning, he takes three digestive biscuits. For instance, in the lunch, he takes tuna mayo sandwiches with 2 slices of ordinary bread, 5 teaspoons of mayonnaise, and a packet of crisps. In the evening, he says it's beef casseroles with large portion of mashed potatoes made with butter, and full portion of spongy pudding with custard. And then in the night, he also have some digestive biscuits. So if you tailor it and pick up the clues which needs to be modified in order to make it more healthier, what changes we could make? So in the breakfast, not just skipping the breakfast, it's not going to help. What it requires is a large bowl of cereals. You can modify it. 2 toasts, you can think of that, because it's going to actually add on to your calories requirement. Large portion of mashed potato, it needs to be reconsidered, and the full portion of sponge pudding with custards. So you need to, the message over here is to modify the quantity of which that we are using it. We are not cutting all the things, but what we are doing is we are limiting and we are balancing our diet plan individualized, and it could be different from for different persons. Let's take another example. Same kind of thing, with large bowl of cereals, three plain digestive teaspoons, and mayonnaise, and it has biscuits in it. So you model it to from large to small, and from high fat to low fat contents. So you need to modify the individual diet plan. Whenever you modify it, you probably first need to explore the baseline dietary habits that a person has, and on the basis of that, you can plan it. Individualized, personalized, and realistic approach to the diet plan. It's not just some fancy things going up and then you need to lose weight for these, having this some products and all. So it needs to be very natural, very realistic. So how does a balanced diet plate looks like? It should have just 25% of starchy carbohydrates, which is rice, potatoes, pastas, or chapatis, or bread. 25% of it should be meat, eggs and pigs, and eggs and beans. 50% of it should be vegetables, salads. Vegetables and salads are there. So not just salads, not just proteins, not just carbohydrates. It should be a balance of all this. And how it should be balanced? Approximately like this. So whenever you're eating, you need to be very careful that how much am I eating. We need to develop an insight that what am I eating, how is it going to affect our health, and does it have all the ingredients like proteins and carbohydrates and fruits and vegetables in it. If yes is the answer, this is your balanced diet that we need to follow. So we talked about balanced diet, the role of carbohydrates in it, fats in it. The take-home message here is you need to balance your diet. Whatever you are taking it, whatever a diabetic patient is taking, need to explore the basal healthy lifestyles, and encourage the patient to spare some time for walk, and so that you can balance the diet. Obviously, a diet plan of a patient or a person who's very active would be different for a diet plan of a person who's very sedentary, who doesn't walk much. So you need to create a balance between the expenditure and the input. If you as a person or a patient or a physician acquires this, the balance, the great balance is something which is the key. Now let's talk some of the points about energy drinks. As maybe students, and in the students, it's something which is a very common thing which is going on. So we'll just take one or two slides. Well, this energy drinks, what they claim is, why we use these energy drinks? We use it because it increases the energy, increases the alertness. We also need to be very alert all the time as doctors, as physicians, as medical students, whatever. It provides us extra nutrition. This is the claim from the energy drinks. And boosts your athletic performance, hours of your concentration, so it increases the concentration level. These are some of the claims that the companies do for their energy drinks. But in reality, what is going on? What we are getting? In reality, what we are getting is mostly just the stiff dose of sugar and caffeine. This is all what we are getting. And look how the companies are presenting this. So with this, so what? People say, okay, we have sugars, we have caffeine. So what? What effect it's going to be on our health? So let's see that. What this health impact of caffeine? It obviously deteriorates your sleep. So it's very difficult, it's very easy to stay healthy at the night when you're having drinks, these energy drinks, to boost up your concentrations, but it's going to affect the long term on the sleep patterns. So you probably have the persons was consuming large amount of caffeines, they probably have sleep problems. What else? Anxiety levels. Caffeine is also activating our bodies. It also increases the anxiety level in ourselves. Mood swings, they are very important. We often see these people who are consuming more energy drinks, they are very labile. They are very normal at the same time. At the second they are very fragile. They are very mood swings. And then withdrawals. So if you don't so if you don't use energy drink, you feel very lethargic, you feel very unfresh, you feel very less alert. So these kind of withdrawals that our body actually responds to it. So how much is healthy? The caffeine amount. Canada recommends, there are different recommendations from different bodies. So if you just pick up one Canadian difference, so in older ages it's very low because the children are already very active, so their caffeine we require is very less. If you go earlier, if you go older, 100 milligrams a day for adolescents is something which they recommend as could be acceptable. So what are the natural caffeine sources? We all need some kind of caffeine in order to stay active, in order to stay alert. But the point is, you can get these caffeines from natural products. Some beans, there are tea leaves available, there are seeds of cocoa beans, and there are a lot of other seeds that are there in order to increase our caffeine level. So what is the role, what is the approach and strategy towards our energy levels and towards the energy drinks? It's read the label for the serving sizes, caffeine content and other information. So it's very important that you know that what is the level of caffeine in that particular energy drink, and you need to be aware of the side effects and the amount that you are consuming. Is it going to be above 100 milligrams, or it's less than that, or am I consuming regularly with this? So my heart's pumping very quickly and things like that. And obviously you need to, they all have the interactions to avoid combining energy drinks with other stimulants like caffeine. So you need to be very careful if someone's taking other drugs or other things. Needs to be very careful that there are interactions within these caffeines. So that's my presentation. Thank you for your patience and for your concerns. If there is any question, I would be willing to answer. All right. Yes.